So my personal experience has given me a deep understanding of the psychological and emotional impact of trauma. In my position as a forensic nurse, I understand what not having treatment can look like, or not having somebody that's trauma-informed to intercept you right in the middle of that crisis. I understand as a healthcare provider and forensic nurse the need for empathy and compassionate care when dealing with victims of sexual violence. Healthcare providers are in a unique role. We are often the first point of contact for survivors, victims of sexual violence. That impact can be coming from a place of compassion and respect. So to better understand how we can take care of survivors of sexual violence, it is important for healthcare providers to be trauma-informed, to have that specialized training, to understand the validation in giving respect and dignity and confidentiality back to these survivors. To further understand the effects of trauma and how trauma affects the body and the brain, it creates recognizing signs of distress much easier, and that we can come from a place of empathy and compassion to empower those and empower the autonomy that the survivors have at the time of discharge and the start of their healing journey. Over the years, I've seen the conversations and the training, the impact that we're talking more about sexual violence. And a lot of that has come from the work that Fear to Freedom has done. They're breaking the silence, they're educating communities and students at universities. And through all of this, we are able to better respond to these survivors and victims. Fear to Freedom has created an outlet that people that are passionate about helping and highlighting sexual violence, they now have a tangible way that they can help impact their communities. Hospitals, law enforcement, universities have come a long way becoming more trauma-informed. The work that we need to continue to do is expanding the trainings in trauma-informed policy, expanding forensic nursing programs out to our rural areas, and making sure that as a community and our organizations, we have a trauma-informed response to sexual violence.